Welcome back and thank you for staying with us. Now to our interview portion where our focus today is about cancer, especially in young children. The National Cancer Institute of Kenya in a report indicated that 70% of the cancer cases are diagnosed at advanced stages, with 2 out of 3 persons succumbing to the disease. Now the institute further notes that every year up to 3,200 new cancer cases among children are recorded. The institute further revealed that only 3 out of the 10 children diagnosed with cancer annually in the country survive. Now, some of the leading counties where these cases are highly recorded are here in the capital: Nakuru, Kiambu, Machakos and Nyeri. Now, joining us this evening to talk to us and where as a country are we in terms of dealing with this killer disease is none other than Dr. Daniel Butorire, a medical officer at the Clinical Oncology Department of the Texas Cancer Center. Daktari, welcome to our studios.
Thank you so much, Hashim, for having me.
Welcome, Dr. And my first question to you will be, this is a report based off the National Cancer Institute 21-22. Yes. Do we have the latest statistics, especially from the Cancer Center?
Unfortunately, childhood cancers are not as much in Kenya compared to other countries. Even when I was going through the latest statistics of what we call the global statistics of 2022, which usually gives us the statistics for the whole countries, where Kenya is among them. You find that among the top 5 cancers, actually childhood cancer doesn't feature as the major cancer in this country. But having said so, still we have cancer cases in children which we are seeing in this country. Looking at the WHO statistics, it says that every year between a child between the age of 0 to 9, about 400,000 cases worldwide are reported in this as to have cancer in the world. So looking at the cases in this country, we don't have as much. But yes, we have a few reported cases, especially where we are talking of leukemias. Leukemias are leading in terms of cancers that affect children in this country, followed by retinoblastoma. This is a cancer that affects the eye, and then the cancers that affect the kidney, what we call the Wilms tumor, or what we call the cancer or nephroblastoma of the kidney. So those are some of the cancers that we are seeing affecting most of the children in this country.
But Dr. there is a worrisome here, given that inherited childhood cancer account for 5 to 10% of such cases. So is this preventable, especially at a younger age like that?
Unfortunately, majority of childhood cancers, as you have said, we don't know the exact cause. Only about 5 to 10% that we can link to a certain inherited genetic mutation. It means that there is a genetic mutation in a parent's makeup that was passed down to the kids, and this one we can link them directly and find it, say, in their children who are having cancer, especially the cancer like we are talking of retinoblastoma. There is a gene, a mutated gene, which we call retinoblastoma gene, that is actually directly linked to such cancers. But when you are looking at these other cancers like the leukemias, which are leading actually in this country, we cannot specifically pinpoint and say that this is the cause of their cancer. And as opposed to adults, we say that when you age, that aging actually helps in destroying or aids in destroying the DNA makeup that causes mutation and predisposing adults to certain types of cancer. Also, there are what we call carcinogen exposure. If you're exposed to a certain type of carcinogen for a long time, long period of time, actually you can develop cancer. But this is actually totally different in children because we cannot find that direct link, especially aging and exposure to carcinogens. So research has been very, very, very scanty when we try to look at what is the exact cause of cancer in children, that we can actually point and focus on that as a point of prevention of cancer.
Now, as an expert in that field, where are we as a country in terms of dealing with this killer disease?
Remember, in the ages of 1970s, actual childhood cancers were a death sentence. But as you clearly said, currently we are able to push this percentage to about 30%, such that if you get children with cancer who are diagnosed with childhood cancer, that at least we are able to treat 30% of them. And the reason why we are not able to treat or to achieve what the developed countries have been able to achieve, actually the developed countries have been able to push their survival rates to about 80%. And this is mainly because of early diagnosis. So as a country, we have been making small strides towards achieving these cure rates. Look at WHO framework of 2018. They say that we want to push this survival rate at least by the age, the year 2030 to about 60%. So we have been making slow but good progressive strides towards attaining survival rates in cancers of children.
And you know, with that burden, Daktari, if parents as well as families that are out there, they hear it is cancer, you know, cost is a major factor.
True.
So when it comes to cost, what do parents require, and especially how much are they likely to spend if their loved ones are ever affected with this disease?
Actually, if you look at the factors that actually has made some of our survival rates to go down to less than 30%, one of them is cost, as we said, and late diagnosis. So cost is a very, very important factor when it comes to access to services for cancer. So, but we have seen a very deliberate effort by the government at least to allow people to use NHIF card to access cancer services. Majority
SHIF.
Now we are moving to SHIF. Majority of our patients actually who are able to access treatment are these patients who are able to access the NHIF services. But when you talk of out of pocket, then cancer treatment becomes very expensive and it cannot be afforded by most of our parents.
Now, some of the treatments that especially kids and people who are suffering from cancer undergo, we know it is surgery, chemo, radiation, but we know the pains that are involved with chemo especially. So are there alternatives that this small kids who are suffering from this illness can opt for aside from chemo?
Of course, you've mentioned surgery and radiotherapy as part of alternatives to chemotherapy. When we talk of childhood cancers, leukemias are mainly blood cancer. And therefore, the mainstay of treatment there will be chemotherapy. Alternative will be bone marrow transplant. And then for those cancers that occurs as solid tumor, especially the retinoblastoma, the cancer that affect the eye, and the nephroblastoma, the cancer that affect the kidney. These are solid tumors that can easily be treated by surgery. And you don't have to travel all the way from up country to Nairobi to access this treatment. Our general surgeons are well trained to be able to tackle these cancers in way of surgery. Then these kids can be sent now to cancer centers where they can access additional treatment, be it chemotherapy or radiotherapy.
And Dr. as we're coming to the end of our conversation, we want to focus on the other issue which has been cropping up of late. Are there other alternatives, especially when it comes to treatment? Because we've seen many Kenyans opting to go outside the country as opposed to getting treatment here.
That medical tourism has been a big problem in our country. But initially, people used to travel outside because of services like PET scan. But now, currently, as we are talking, we have PET scan services available in this country. Another thing that used to lead to a lot of tourism of patients to other countries like India used to be bone marrow transplant. But as we are speaking, currently we are able to perform bone marrow transplant in our country. So it's just lack of awareness and lack of information. People don't have that information that actually these services that they are seeking from outside, they are available and easily accessible in our country. Yes.
And what are some of the cropping challenges that the government needs to address? Not just the government, but also in the private sector. They need to ensure they are addressed so that at the end of the day, when it comes to medication of such young people, at the end of the day, is facilitated.
Of course, facilities, more facilities. Like now we have moved to county level. At least every county should have a government cancer center where people can access these services, and not just services of chemotherapy alone, because we are seeing a lot of improvement in counties where chemotherapy is able to be offered in many counties. But machines for radiotherapy, machines for and even services like bone marrow transplant are only available in Nairobi. So if we can be able to improve on facilities. And another thing is training of more health practitioners or cancer specialists who can be able to move to these counties and assist in treatment of these cancers. Another thing is to be able to make medicines available and affordable for our patients.
Dr. Give us your final remarks, and of course tell us where we headed as a country. Is this cancer, people are going to get affordable medication attentions when, at the end of the day, their loved ones are befelt with this disease?
First and foremost, I also wanted to say that I'm a member of Kenya Society of Hematology and Oncology. And Kenya Society of Hematology and Oncology, KESHO, hosts conferences and also continuous medical education in order to make sure that we improve the skills of cancer practitioners in diagnosis and implementation of cancer services. And for this, Kenya Society of Hematology and Oncology has organized an international conference. It is called Kenya International Cancer Conference, dubbed as KICC 2024, that will be held in November from 21st to 23rd, and registration is currently ongoing, so that people can come and listen to the new technologies that are available in terms of treating cancer. And for the government, I think we still continue to urge the government to allow people to access these social insurance services so that they can be able to access actually the medical facilities and in terms of cancer treatment.
Okay, thank you so much. That is Dr. Daniel Butariria, a medical officer at the Clinical Oncology Department of the Texas Cancer Center. Thank you for joining us this evening, Dr. And of course, the conversation continues, especially when the Ministry of Health confirmed that cancer will be, of course, covered under the Social Health Insurance Fund once the fund is up and running, and that will be on the 1st of October 2024. Now, elsewhere, women have been advised to prioritize their mental and emotional well-being both at work and at home to stem the rising cases of distress within the community. Employers are also being urged to create a favorable atmosphere at the workplace that allows for employees' productivity.